Hello friends and welcome to Math Simplified. In this video we will discuss about the urinary tract infections. We will discuss about the symptoms, causes and the treatments of the urinary tract infections. The human urinary system comprises of a pair of kidneys, a pair of ureters, the bladder and the urethra that perform the basic functions of the body like filtering your blood, urine formation and blood pressure regulation. Infection of any part of the urinary system is known as a urinary tract infection or UTI. Urinary tract infection is a very common and painful human illness. In the United States only, urinary tract infections account for nearly 7 million office visits, 1 million emergency department visits, and 100,000 hospitalizations every year. The cost of these infections is significant, both in terms of time lost at work and cost of medical care. Even Hippocrates, who is considered as the father of the medicine, wrote about this disease that appears to be a type of urinary tract infection and wrote that the illness could last for a year before it resolved or eventually worsened to involve the kidneys. Now let's look at some of the important symptoms of the urinary tract infections. Burning with micturition, having to urinate frequently, urge to urinate even on an empty bladder. You can develop fever. You can have low back pain or flank pain. You can also develop nausea and vomiting. Rarely blood or pus may be visible in the urine. Urine can appear cloudy or strong smelling. Now let's look at the most important causes of urinary tract infections. The bacteria E. coli is the single most commonly involved bacteria in a UTI. And there is a specific strain of this bacteria that is responsible for almost all UTIs, and that is uropathogenic E. coli. Other bacteria that cause infections in human urinary tract include Staphylococcus, Klebsiella, Pseudomonas and Candida. The bacteria enters the bladder via the urethra. After gaining entry into the bladder, E. coli are able to attach to the bladder wall and form a biofilm that resists the body's immune response. However, infections can also occur through the blood. One of the most important causes of urinary tract infections in females is through intercourse. Urinary tract infections occur 4 times more frequently in females than males, probably because in females the urethra is much shorter and closer to the anus. Other common causes of urinary tract infections include urinary catheterization and diabetes. It can also occur in people with large prostate and people using certain contraceptive methods like diaphragms for birth control and women who are using spermicidal agents. After menopause, a decline in circulating estrogen causes changes in the urinary tract that can make you more vulnerable to infections. Now, to diagnose that you have UTI, the first test you should do is a urine analysis, which is a simple and basic test for checking the presence of urinary nitrites, white blood cells, also known as leukocytes or leukocyte esterase. Urine microscopy is the next step, which looks for the presence of red blood cells, white blood cells or bacteria in your urine. Your urine culture is positive if it shows a bacterial colony count of greater than equal to 10⁻³ colony forming units per milliliter of a typical urinary tract organ. The next important question is, how do we treat UTI? Well, we at Math Simplified believe that any medication taken without guidance of a trained medical professional can have grave consequences. However, the mainstay of treatment of urinary tract infection are just antibiotics. Medications frequently used are nitrofurantoin, fosfomycin, which are the typical first-line drugs. Nitrofurantoin is sold under generic names like Niftas and Uriton and is a good urinary antiseptic. It is taken 5 days a week with 1 dose in the morning and 1 dose in the evening. If nitrofurantoin doesn't work, other antibiotic options include cephalosporins, amoxiclav or fluoroquinolones. With treatment, your symptoms should improve within 36 hours. You might have heard that cranberries help to prevent urinary tract infections. Some researchers have a theory that some component within the cranberries makes it harder for the infection causing bacteria to get a good grip on walls and helps to prevent the urinary tract infections. Cranberry extract is also a component of many urinary tract infection targeting medications. I've posted some links to cranberry juices and extracts that I have personally used over the years. They work very well for mild to moderate urinary tract infections, and I would advise anyone to try natural methods first before jumping onto medicines. So this was all about urinary tract infections. If you like the video, consider supporting us on Patreon or joining us on YouTube by clicking the join button below, as this will help me hire more people and make better videos for you guys only. Thank you for watching. See you in the next one.